Cleft palate is one of the most common birth conditions that we see in our hospital. A child with cleft palate has a big or small gap in the roof of the mouth, and because of this, when the child tries to feed or suck, the milk escapes out through the nose and there is a leakage of fluids. At Al Jalila Children's Hospital, we have a full team of specialists that is able to help your child, starting from the feeding specialist, ENT, speech therapy, the surgeons, and even the dental providers that are contacted at a later stage.
Many kids with cleft palate do have some fluid behind their eardrum, and this is very important to diagnose because this causes some degree of hearing loss. Hearing loss is very important at this stage because this is when the kids actually start developing proper speech. Here at Al Jalila Children's Hospital, we work as a team. So after the plastic surgeon sees the patient, we see him along with the audiologist, where we check if there is actually fluid behind this eardrum. And if there is, at the time of the surgery to repair the cleft palate, we do ear tubes at the same time. This is very important in order to prevent ear infections and to encourage proper speech development.
At Al Jalila Children's Hospital, we are dedicated to provide the best possible care of our young patients. That's why we are thrilled to announce that we are using state-of-the-art technologies during our cleft palate surgeries. By using the surgical microscope, we are ensuring that we have a better visualization of the details and performing the surgery with utmost accuracy. That will benefit the patients with a better outcome and faster recovery. At Al Jalila Children's Hospital, we are committed to stay at the forefront of medical advancements, ensuring the best possible outcome to AE children.
يمثل دور أخصائي النطق واللغة دوراً أساسياً في عملية تقييم وتشخيص وعلاج مرضى أطفال الشفة الأرنبية وسقف الحلق المشقوق، ويتشارك الأخصائي مع باقي الفريق المختص المكون من الجراح وطبيب الأنف والأذن والحنجرة الآراء بشأن هذا الموضوع ما قبل التدخل الجراحي وما بعده. ويتطلب المرضى في معظم الحالات تدريباً على أمراض النطق واللغة، حيث أن من أبرز مشاكل الصوت والنطق واللغة عند الأطفال في مثل هذه الحالات تتمثل في الخنة الصوتية الهايبرنيزاليتي والاستبدالات الصوتية والعمليات الفونولوجية الغير صحيحة التي تؤثر على تدني وضوح الكلام وعدم المفهومية عند التواصل مع الآخرين.